All right, good evening, everyone, and welcome to tonight's informational session on the Allied Health Academy. I'm the program coordinator, Dr. Wendy Bruffy. Ms. Travai is here as well. She'll be available to speak to you later this evening. So a little bit about the Allied Health program in our academy. It's a 2-year program open to Kinnelon High School students in their junior and senior year. A majority of our courses are Rutgers-based courses, which mean that you get college credit for participating in the courses as long as you pass their test. So Rutgers supplies a test at the end and you take the test. If you pass the test, it's called, credits by examination, they call it, similar to the AP. We also are involved with the County College of Morris, which supplies us credit for sports medicine. That course runs a little bit different. Whatever grade they get at the high school level is the grade that they will see on the transcript. We also, in the academy, participate in what's called Global Health Squads. We do a medical program through an international program where the students connect with different programs, either in Ghana, Honduras, Guatemala, I think is another one. We've been focusing with Honduras, and for the past 2 years, we've worked with them in a medical program where the students have shadowed medical professionals out in Honduras virtually. And we've also, this year, we're working in a public health situation where the students are working on a situation and they're trying to solve a problem that relates to an entire community. So that's what they're doing. And then we have a 2-year clinical rotation with St. Clair's Hospital. So the students go out for about 10 weeks and they go to visit all the different departments in the hospital, and they shadow nurses, technicians, and they go around and learn about the different, basically the different careers that are available in the hospital setting. It's a great experience. I'm sure some of our students here will tell you. Imelda knows firsthand back there on how the program has run. She did her first year of clinical rotation. She's a senior now. She did her first clinical rotation last year. She'll be on her second clinical rotation this year. So she'll be able to tell you a little bit more about the experience from a student's perspective. So since it's a 2-year program, this is an example of what the 2 years would look like in terms of courses. So students still need to obtain their regular classes to graduate and have their prerequisites for college. So in the morning hours, they do their math, their English, their physical education, any of those courses that are required for graduation. And then in the afternoon, they spend their time with me on all of the allied health courses. That way also, when they go out and do rotation, they're not missing other courses. They're only missing classes with me so that I can keep them caught up. So this is an example in the first year, Dynamics in Healthcare. So that course is 3 credits. That's a Rutgers-based course. Sports Medicine, which we just got accredited again with CCM for this school year. It's 4 college credits. So the students, again, that is like a set, whatever grade they get in the class, that's the grade they will get for that course. Dynamics is, again, a test, credit by examination. And then you have it's Introduction to Health and Wellness. It's actually Fundamentals of Health and Wellness is the Rutgers name for it. And that's 3 credits through Rutgers. And then Scientific Principles of Nutrition, which is also new this year. That's another course with Rutgers. And then we have Intro to Clinical Research. We have Intro to Clinical Research 1, and then we have Intro to Clinical Research 2. Intro to Clinical Research 1 is a Rutgers-based course. So again, credits by examination. It's learning what it's like to do clinical trials, the different phases of clinical trials, examining research, because there's a lot more to the health. Of course, everybody thinks, doctor, nurse, but, there's an array of allied health careers available. So that's why we have a big scope here, trying to educate the students in all the various career opportunities that are available. So intro to clinical research, again, is it's credits. Next year, it's anatomy and physiology. In anatomy and physiology, the students can obtain up to 11 college credits for that one course. Because I'm a college professor as well, not just a high school professor. I teach at Colwell University in the Department of Natural Science, and I basically have all of the public health and nursing students in the college. So what I do with anatomy is I break it up into semesters. So we have anatomy 1, semester 1, anatomy 2, semester 2, and then medical terminology. The students sit at the end of the year for the medical term because they need both anatomy 1 and anatomy 2 medical terminology in order to sit for it. So first half of the year, so come after second marking period, the students will have the ability to sit for the Rutgers Anatomy 1 exam. They pass that exam, we move on, anatomy 2. Okay, and then they get 4 college credits for each one. So that's the 8 credits. And then at the end of the year, when we've completed all of medical terminology, then they get to sit for the medical terminology examination, which is 3 college credits. So again, it's test by examination because this is through Rutgers University. Another course offered is emergency and clinical care, which the students are going to work with our Juno back there to show you our mannequin. We are one of the only schools, public schools at the high school level with Juno. She is a mannequin that does all of the stuff that they would learn if they were in like the nursing program. So we have, very fortunate to have the opportunity to have Juno, and they will be giving a little presentation in a few minutes. So along with that, emergency clinical care we spend a lot of time using Juno for emergency and clinical care, learning how to handle and triage situations. She's also good for phlebotomy. The students will learn phlebotomy here. So they will learn how to draw blood. Okay, so that is another thing that we are working on getting them certified in. They'll have to go out to do the sticks, but they will do all the they'll have all the training here, and they'll have to go out and do the training elsewhere on live people. But we will have them all set and ready to go when the time comes. And last, clinical research capstone project. That is where Intro to Clinical Research 2 comes into play. That is where the students get to present their own research. So in essence, they learn Introduction to Clinical Research. They learn all about it. Then they develop their own research. We'll use the Board of Education as our institutional review board, and they will decide on, whether or not the student can proceed with their clinical research. So very excited. This is our first year. Students will be presenting, I think, in January, right, Mr. Roy? They'll be presenting in January, so we're very excited to see that. So look for that when you watch the Board of Education meeting. Okay, so here's our Juno, and you can see the students working on her. So again, Juno is through CAE. She's our mannequin, but I call her she just because I have her set up as a she, but we have both anatomical parts for the mannequin, so it can be male or female. Juno is, again, very modern, teaching you all the nursing skills. Certified nursing assistant, we're looking at trying to get the students certified as certified nursing assistants so that they can go out and work in the hospital setting under nurses. There will be an examination required for that as well, but we are working on that for the future. This is a little bit about that global health squads that I was just telling you about with Honduras. So you could see that it's a virtual shadowing experience. As I said to you, it's we did the medical one last year. This year, they're doing the public health. This was an example of just the medical itinerary. So this was last year's itinerary because the students are just working in this now. So they're presently doing the public health. In fact, tomorrow they have to put on a big presentation for an entire community of Honduras. So they're going to have a bunch of community members. They're going to be online, and they have to put on an hour presentation for the community members on how they plan to solve the issues. So maybe the students can tell you a little bit about that when we get back to them. But this is just to show you a little bit. So there's like an introduction. The great part is they also have to do a little Spanish speaking. They've had to do that. Thanks to Attilio for helping with that this time around. And they do the clinical preparation, so they get to go out and go into the clinical setting, speak to the patients, and it's great because it's virtual. So it's, they're working with another country. You can't beat that. It's something totally different, and we're very fortunate to have this program. Okay, so some of the future goals that we hope to achieve, again, we're looking at maybe outside neighboring schools coming. Training in phlebotomy, which you can see we have an arm. Attila, we have the arm and we have the hand back there, which you guys online will see in a few minutes. And again, we're hoping to get phlebotomy certified. The thing that stops us is that, again, they have to get 25 sticks outside of the classroom. So I'm working on connecting with a school that will supply them some live patients, but I will have them completely trained here on how to do it. So they will have the technique and the skills. They just need their live patients once that goes underway. And then once again, certified nursing assisting, they'll be set for preparation for the exam, but they can't take the exam until they're 18. Okay, so that's the thing. It's once the students are 18, then they can sit for these exams, and then they'll be able to work in settings like laboratories. So again, LabCorp and Quest. That's why it's great to have phlebotomy. It's great. So while the kids are going to school, they have something to do on the side while they're going for their training, whatever career choice they pick in the health sciences. Okay. So I'm going to turn this over to my students. You'll hear me controlling our mannequin, Juno, and I'll let them all introduce themselves, and maybe you should start, guys, by explaining, your names and what level you are, and then if you don't mind, tell them a little bit about the program, and then we'll get underway with Juno.
My name is Imelda, and I'm a current senior at Kinnelon High School, and I've been a part of the Allied Health Academy for 2 years now. And it's a program where people who are interested in healthcare and science courses. We've been able to go to hospitals to shadow doctors and nurses and just different career pathways to explore what we want to do, what we don't want to do. And global opportunities, like you just heard Dr. Barkley speaking about, and exciting things like that.
I'm Farhan Hinton. I'm in year 1. I'm a junior, and like Amela said, we've been helping other communities. There's a lot this program offers, and I'm gonna pass it over to Attilio.
I'm Attilio, and I'm a junior, and it's really rewarding to be in this program because we get to see a lot of things like this. Not a lot of high schools have it, so definitely a new experience.
Okay, so today we're just going to be talking a little more about what the program has to offer, and we're going to be showing you a little scenario, something that we went over in class while we were doing first clinical care and practical exams. Dr. Murphy, she tends to have us moving around and using practical scenarios so we can put our learning to practice. So this is just one of those scenarios. Today we're going to be talking about FAST training, which stands for First Aid for Severe Trauma, which I have been licensed in. Dr. Murphy got us certified in, and they are currently learning and will be certified. So this is Juno, our patient simulator, and we're, like Ottilio said, very grateful to have her because we don't see this in a lot of other public schools. We see this in nursing schools and tech schools, and it offers us a lot of opportunities to learn about the things that we're learning in class. It takes things out of the textbook and paints a picture for us about what we're learning. So today we're going to go over a scenario about how we approach a traumatic situation. Ottilio Karan and I are just walking down the street, and all of a sudden we see Juno on the side of the street and just laying there. So this is how we would approach. First, before we get into any situation, we have to do something that we call scene size up, which is just doing like a 360 and looking around and making sure that we're in a safe situation. A lot of the times when there's like car accidents and things like that, people need help and they're on the middle of the road and you want to put yourself, you want to go help them, but you have to think about where you're going, what you're doing, because you don't want to be the next person down, because that's not helping anyone. So once we do our scene size up and we make sure that everything is safe for us to enter the scene, we'll go in and we'll just, I'm going to say, introduce myself and just see if the patient is conscious. So I'll say, hello, can you hear me? And so in this situation, our patient is conscious. So what I'm going to do is go ahead and introduce myself and ask for consent, because you cannot touch anyone, you cannot treat anyone, no matter how obligated you feel, without gaining their consent first. So I'm going to say, my name is Amalda Phillip, and my friends and I are first aid trained. Can we help you?
Yes.
So now that we've gained consent, we can go ahead and ask, what's wrong? Juno, can you tell us what's wrong, ma'am?
My leg hurts.
Her leg hurts. So in this situation, we know that it's a accident, that she's just laying on the side of the road, and all three of us are first aid trained. So I'm going to ask Otilio to check her neck and her head for any sort of trauma that could have happened. I'm going to ask Karan over here to please go get the first aid kit and call 911 also. So, sorry. While Otilio is putting on her neck brace, making sure that her head is just safe and secure, she said her leg hurts. So we're going to try and see what's happening with her legs. And if we move over to this side, this is one of our features we have with Juno, is that we can attach lacerations. So we see that she has a laceration on her thigh right here, and she's bleeding. So at this point, you're going to grab, first before you touch her, you got to put your personal protective equipment on. We're all going to don our gloves. And because you want to make sure you're protecting yourself from any sort of infection and things like that. And I'm gonna grab gauze from the first aid kit, and I'm going to apply direct pressure on her thigh. How we're gonna do that is I'm just gonna interlock my fingers, and I'm just gonna press over, and I'm just gonna hold direct pressure over her thigh. And if the bleeding stops, then it stops. But if the bleeding doesn't stop, and if there's more than half a can of soda's worth of blood, then I'm going to ask Karan to please grab the tourniquet while I'm holding direct pressure, and he's going to apply the tourniquet for us. I'm going to move over here. So
It hurts.
we're going to reassure the patient that they're going to be fine, because it's going to hurt them, but this is what we're going to have to do, because the tourniquet basically cuts off circulation to stop the bleeding from happening. So so Karan is going to interlock his fingers and hold direct pressure while I apply the tourniquet. So you're going to want to apply the tourniquet 1 to 2 inches above the wound. So I'm just going to put it underneath her leg. And you're going to hook it. Okay. We're going to hook it on here, because there's a little hook on the tourniquet, and you're going to tighten it up to the tourniquet. And we're going to tighten the tourniquet up to her thigh. We're going to take this little rod that we have here, and we're going to tighten it until it cannot be tightened anymore. And we're going to attach it to this clasp. Put it on here.
Ow, that hurts.
We're going to be okay, Juno. And Otilio, how's everything going with her?
Everything's good, and she's alive.
All right, so now the bleeding has stopped. And the thing about a tourniquet is that we're calling 911, and they're on their way. The thing about a tourniquet is that you can't take it off, even though the bleeding has stopped and things like that, because the only person who takes off a tourniquet is a medical doctor at the hospital. And we're just going to continue to wait with the patient until the medical professionals get there to help. And that's one of the things that we learned inside of the classroom. But outside of the classroom, like Dr. Murphy mentioned, we leave school for 2 days out of the week, and we go to St. Clair's Hospital in Denville and Dover, and we shadow healthcare professionals, and I've been able to see different like specialties into the lab. I've seen people make the pharmacy. I've seen people make drugs and send it to patients depending on who they are. Some blood testing happen. So we're just we're given experience before we make a choice about what kind of career we want to take and things like that. And with the global health brigades, I know that Karan and Atulia can probably speak about this. We have the opportunity to look at healthcare from outside of the U.S. because it's not the same all over the world. It's so different. And so learning about different people, different communities, and how they treat illnesses and problems, it's just so encouraging. And yeah, if you guys want to add anything about the program, you can too.
Well, global health brigades, we get to work with doctors outside the U.S. and they really give us a lot of insight. We also get to work with them on the problem. We get to brainstorm our solutions for the problem. And tomorrow, actually, we're presenting to the community our solution and our presentation that we've made over the past couple weeks.
Couple weeks, yeah.
It's been like, yeah,
Couple weeks.
10
Our
weeks,
solution
yeah.
to the whole community in Honduras.
This is a real community that has these real issues that have been presented to us, and over these past 10 weeks we've been learning about this community. We have had interviews and meetings with people from the community, and we've spoken to them about what they think they are struggling with. So some of them don't have clean water, they don't have access to education, so a high school just doesn't exist for them. So they have to travel miles and miles just to receive a high school education. So problems like that we're learning about, and we're trying to help build solutions and things like that, and we're presenting that tomorrow to the healthcare.
What is the solution? What is the problem?
For the
I
problem.
need to know now.
now we need to know. I know.
So the program that we work with they're known for building these things called sanitation stations. So a lot of people don't have bathrooms at home, so they just go out, and it's very unsafe for, especially like when little girls travel to go use the bathroom in the middle of the night, like you don't know what could happen. So we suggested low, like budgeted latrines, so little like hygiene stations and things like that for people, and also to employ people to keep it clean. So that's like giving people jobs, but also keeping people clean and giving them bathrooms. So that's tackling two issues one time. And water filters, to provide water filters so that we can filter the water that's coming into the community so it's clean, because they have a lot of water, it's just not clean water. So that was the problem. And just things like that. It varies, it's different with every community. This was just
So those are your two focuses.
yes, clean water and latrines.
And you had did they give you, I can't remember, did they give you the budget, or did you have to propose a budget for how much this was gonna cost?
Yeah.
Because I know you had to do it on the cost.
The budget in their currency.
Yes. And they have to put it on tomorrow in English and in Spanish.
That's fantastic. Atilia's our like Spanish translator.
Attilio has all of the Spanish component. He's done a fabulous job. But I have to say, it's a great program, and the experience that they're receiving is amazing. And considering we can do that online, and they have this experience meeting people outside, is just amazing.
The other thing, and hi, I'm the science supervisor, but the other thing that I got to see when I was with them during this program is that the group in Honduras is sharing risk assessments that they have done and data that they have collected. So it's spreadsheets of data, of questionnaires and information that the students have had to process and analyze to be able to first determine what the problem was. So it wasn't just here, this is our token members in our community and what they think the problem is. No, this was built on risk assessments that were given to them and data that was collected over time and shared with the students. And the students had to really kind of mine that data and take a look at what they felt were the issues. They had to report back to the group on what they thought the issues were, and they had to back it up with where they found it. like what data they were using to support those ideas. So it's pretty rigorous program. It's pretty intense. When they meet every week, it's quite busy. They do meet during their sessions for
It's an hour and a half.
the 90 minutes with this one group talking to several professionals that work for this organization. And I think the students really get a good sense of what healthcare issues are outside of the United States and what kind of real issues they're dealing with that we don't even think about. We really don't think about the fact that going to the bathroom at night is a concern. And yet they talk about how young children and girls get attacked and everything because they can't just to go to the bathroom. So things like that they've discussed, and they've actually had a chance to really reflect and think about like how our situations are here and what other communities around the world are dealing with. So.
Another thing is like we're not only learning about the community, but we get to interact with the community beforehand. So it's not only tomorrow when we're presenting, you get to interact with the community beforehand, and then.
Yeah, and then several community members will be on tomorrow with them to ask them questions. So they'll actually it's like I think tomorrow's 2 hours. And yeah, so they'll be presenting for an hour, hour and a half. And then the community members get to ask them questions. So it's going to be very rigorous for them tomorrow. They've been doing this for, I think it's like 8 weeks and 2 times a week. They've been meeting to handle the situation. So, do you guys have any questions? Anybody have any questions for Shirvai or for me or for the students? Okay. All right.
The main concern about being accepted into this program and joining this group is to make sure that after this presentation, even if you are a freshman, you have to wait until sophomore year to apply because it's a junior-senior program. But I would, if you're a freshman, go ahead and go to your guidance counselor and tell them that you're interested in doing this as soon as you really make up your mind, because they can assure that you're taking the right courses and you meet all the requirements that you need to graduate. So you want to make sure that you get all your graduation requirements in for other areas outside of the sciences, because you'll have plenty of sciences. Science, and this also counts for your 21st century skill requirement. So the guidance counselors are all aware, and they can help you decide on what courses you need to take, and if you're interested in the program, what you need to do.
Okay, and if there are any other questions, feel free to email me. The email's on the brochure, but it's brooklynw@kinnelon.org. So if you guys want to reach out to me with any questions, or anybody online has any questions, feel free to reach out. Okay? Thank you. Thank you to the students.
Thank you.
Thank you to the parents for attending.
Thank you so much.
Okay, and any questions, don't hesitate. Have a great night.
And you can get up and take a look at Juno if you want to
Yeah,
take a closer look at